Welcome to the Dental Implant Practices podcast, where each episode will explore how to integrate dental implants into your practice and into bone, with your host, Dr. Philip Gordon.
Hey guys, thanks for being listeners to the show. Go to dentalimplantpractices.com and find all of our resources. Also find us on Facebook, Dental Implant Practices page on Facebook, and go to iTunes and leave me a review on iTunes so we can help spread the message. Thanks. Welcome back to another episode of the Dental Implant Practices podcast. I'm your host, Philip Gordon, and today it's a huge honor for me to be introducing Dr. Gina Dorfman. Gina, thanks for being on the show today.
Thank you for having me.
Yeah. I know you're really busy with a lot of things. You're doing a lot of travel, some of it for work, some of it for pleasure. You run a very busy practice, and you're also the creator of the Yapi dental company. So you are in Santa Clarita or Valencia, which is just north of Los Angeles. So for people that maybe don't know your story, Gina, I'd like to start off with your story about kind of how you got into dentistry. A little bit about how you got into private practice, and then how this Yapi product came to be. I know your product is basically a paperless workflow solution for dental offices. It's not dental implant specific, but I wanted to have you on because I use your system. It's a great practice management tool, and we always have to keep one eye on the business. So I'd love to get into your story and then get into your product and kind of go from there. And also, for the record, you have no relation to the other Dorfman in dentistry. Is that correct?
I do not.
Yeah. I'll just get that out of the way, since I'm sure you get that asked a lot.
every time. I wonder if he gets asked.
I'm sure now that he does. Yeah, he's getting asked the other way. Are you related to Gina? So.
Well, thank you so much for having me on this show. A little bit about myself. I graduated from USC School of Dentistry in 2000. I originally went to dental school because I love the idea of being in a medical field and be able to help patients. And my grandmother was a physician, but I honestly could not see myself in in a urgent care environment or giving bad news to people. And I decided to look into dentistry. I got a job. My first job in a dental office was actually as a filing clerk. I spent a lot of hours filing charts and pulling charts and printing routing slips. And so I don't know if that was my starting point with Yapi, but I kind of tried different jobs in a dental office. I did insurance. I presented treatment plans. I worked as a scheduler. Right before dental school, I managed a very large mobile dental practice with multiple locations and multiple coaches. So I've learned the business of dentistry, and I also realized that I was really interested in becoming a dentist, and so I ended up going to dental school. So I graduated in 2000, and I started working as an associate first in a small private practice. Just really didn't have enough patients for me. So then I went to work for a large clinic. I did a lot of pedo there. I did a lot of different things. And I've learned that it was time, 2 years later, it was time to start my own. I started from scratch in 2002. And I've never looked back. I mean, it was just an amazing experience building a practice. It was so much fun. I wanted to be paperless from the beginning. And so I had a practice management software that was supposed to be paperless. I didn't build a filing unit. And I tried everything. We tried so many different things, and nothing just seemed to work. There was always some sort of a paperwork involved. We would print forms, patients would fill them out, then we would scan them into the system, then we would shred the forms. And I think what really led me to developing Yapi is having multiple moments where, whether it was intra-office communication or it was paperless or it was, appointment reminders, a lot of different things where I would just say, you know what, there's got to be a better way to do this. There's got to be a more efficient way. And after having a string of those thoughts and moments, I started talking to my dad. My dad is a software engineer, I kind of bounced different ideas off him and complained a lot about the current practice management software. And one day he calls and he says, "Okay, stop complaining. What are you trying to do here?" And next day he showed me a prototype of what Yapi is today.
That's great. I mean, it's very interesting that you have the history there. To be working in an old school office with the charts and the filing and the stamping and the scanning and all that, and then still starting your new practice in the modern era. And yet we still have those problems. Even if you had a paperless system, right? You were still scanning things into charts. And, we called it a paperless system, but it was actually far from that. Even when I graduated dental school in 2009, and we were using a paperless system, we were still using tons of paper. So it's and even back then I remember thinking 2009, 2010, I remember thinking, why can't I just hand somebody an iPad and have them fill out their chart on that, have it sync to the system, and why is this so confusing in the technological age that we have? And I think it just took somebody to be on the inside to see the problem, see the need, understand a solution, and then come up with a fix for it. And that's a great story that you were able to do that.
Thank you. It was, here's the thing, I always say that it's not necessarily about the paper. There are very good uses for paper in a dental practice, from toilet paper to paper points for endo. I mean, when paper is the most efficient tool, then by all means use it. But it's not just about the paper. I mean, of course, the cost of the paper and the toner, and it all adds up, but it's the time that's, most precious in a dental office. If you look at the expense sheet in every single dental office, the highest expense is going to be the team, right? And where everyone is talking about, lower insurance reimbursements and patients not always having the budget to pay for everything that they want. And yet we have a lot of resources in the practice that we're squandering because we don't have good systems. And the truth is, in any dental office, there are two types of jobs. We have a part of our work is creative. This is when we put our dentist hat on and we interact with our patients. We'll learn about their needs, create treatment plans for them, and then we execute on those treatment plans. And that's the fun part. That's when we get to build and solve problems and challenge ourselves. And then there is the mundane, the routine things that have to be done every single day in order for us to be able to help the patients, such as, scheduling and gathering patient information and getting patients back into the office and billing, sterilization, ordering. All of these things take time. And the more efficient we are, the less time it takes and the less money it costs for us to be doing all those things. And of course, all those things are also usually done. I mean, we don't have most offices don't have, paperwork hours, right? All of these things are done while helping patients. We think we're multitasking, right? In the front office. And I remember this was one of my, there's got to be a better way moments where I bring the patient to the front and my, the scheduling coordinator is at the front on the phone, maybe scheduling a new patient appointment. So now I'm there with my patient, ready to have the patient check out. Maybe I want to communicate some information about the patient, what to schedule them for. Maybe I want to make sure that they leave with a bottle of Peridex or, little details, nitrous, prescriptions. And I want to make sure that all of those things get done. But she's on the phone, and now she's putting the patient on hold. I briefly tell her something that I want her to do, or maybe I'm writing it down on a routing slip. I have to go back. I have another patient. Then another patient walks in. My next patient is now checking in. So again, she has to stop what she's doing, and she has to now see, does this patient need any paperwork filled out? She pulls the form, she gives it to the patient. Then she has to enter all that information in the computer. And not only, again, all of this is time consuming, but think about the potential for making a mistake, for forgetting to call in those prescriptions, or mistyping email address, because the reality is, while we think that we're multitasking, the human brain is not built for multitasking, right? we're just switching quickly back and forth between different activities, and it's fatiguing our brain. It's stressing us out. We're making mistakes. And some of those mistakes in a dental practice could be quite costly, right?
Yep. Yeah. No, absolutely. I mean, we're only capable of doing so many things at once, and most dental offices don't have an insurance department, an inbound phone department, an outbound phone department, a checkout department. And yeah, they may have one or two front desk people that do it all. So the ability to streamline processes, cut out the wasted time, is essential. Anything that makes you more efficient and reduces the errors, I think is a necessary thing. So let's talk about your products here. Let's go into Yapi. I mean, some people may not know what it is. They may be thinking, okay, well, what is it that this tool does? Kind of explain, from the top, what is Yapi's solution, and what are its functionalities?
Absolutely. Well, from the top, the very broad description is it's an automation software, and it's designed to work with practice management software, completely integrated, to do a lot of different things. We have a lot of features, and each one of those features was designed to streamline, automate, or possibly eliminate a lot of the routine daily tasks that have to be done in a dental office in order to take care of our patients. There are multiple, modules. One is the paperless. We already talked a little bit about this, and with paperless, any form can be filled out on an iPad, which is great because patients can zoom in on little details. You can draw on the form to catch, to get someone's attention on a specific piece of information. And all of that goes seamlessly into the practice management software. The information is populated in the fields in the practice management software, Dentistry, SeagleSoft, Open Dental. We work with different systems. And the copy, the signed time stamped copy, is saved in the practice management software as well. So you have your legal documentation. And you recently interviewed Jeff Toner, so all of that is very important, and it's clearly organized, it's clearly presented, and it's a great tool. Also, we have online forms for new patients, and this is one of the advantages with Yapi is everything is integrated together. So let me show you a little process. When a patient calls to schedule an appointment, once the appointment is scheduled, an email goes out to a patient inviting them to fill out the forms. These forms are not on some sort of a portal where a patient has to create a login, and then you have to log in to see those forms. This is right on your website. So you're sending patients to your website, they fill out the forms, and as soon as they click submit, the form goes back to your office. And I've had that experience before where I've done this, and then I come to the office and they give me a clipboard, and I say, wait, but I did the form. And they say, oh, okay, well, let me check. And so they go into portal, and this would never happen because the office is immediately notified. There's a pop-up right on the desktop that says new information was received. And so this information stays in the queue right in their desktop Yapi, and they can review this and just update the practice management record right away. So this is, and another thing is, if anything is missing, this is you can't do that with a paper form. If they put down the information incorrectly, for example, maybe they mistyped the email somehow, Yapi will alert that it's not a valid email address. If they skip something like social security number, Yapi will make a sound to alert them, okay, you missed something here. So a lot of safeguards are built into making sure that the information is correct. And as patients return, they can update their information also on an iPad. So Yapi will pull the information from practice management software. Everything will pre-populate. They can check the information, and if everything is correct, they just sign. It takes just a few minutes to do it. And also what's important is that you can see the changes really easily. So if the patient changed the medical history, you don't need to go back to the old one from a year ago and review the system. That's one of the ways that we streamline and save time. The other is our dashboard.
Well, let me pause you here just a second, if I could, Gina. Now,
okay.
When we talk about forms, so you've got new patient forms, So that covers everything from health history to, name, address, all of that. But then you also have consent forms too, and you also have, just cover the bulk of the forms you have, because I know, if you're seeding a lab case or extracting teeth or replacing implants or doing endodontics, you've got a whole list of consent forms that are pre-populated, and then you can also modify those too. So just kind of break down what all the forms that you have.
Yeah, absolutely. Yapi comes with a library of forms, and I can't think of a form that we don't have. Pretty much any procedure you would want, we have a form for you. So this is actually a great resource for startup practices, because they're starting from scratch. They have nothing, and we give them those forms that were, written by attorneys. so those are quality forms, and any procedure, including things like approval placement. When you're cementing, a lot of veneers, for example, you want to make sure that the patient signs off on the cementation. So even small things like that, photography consents. So obviously, implants, endo, any kind of perio-oral surgery. And then we also have ability to pretty much any form that you have on your computer, anything you have on your computer, you can print on an iPad, essentially. So, for example, if you're presenting a treatment plan to a patient, you can present it on an iPad, and the patient can sign right there. You can generate treatment plan in Dentrix, for example, and once it shows up on an iPad, again, the great thing is you can zoom in, you can circle something on a plan, and then the patient signs. You can email it to them or to their spouse, or you can, save it in the chart. And one of the things that I really like to do, because in my practice, I never mentioned my practice. I have 5 associates right now. We do everything from pediatrics to implantology. So a variety of procedures, busy practice. And one of the things that I like to do in my practice is same-day dentistry. If a patient is in my chair and they need something small, maybe, they just had a cleaning and they need an occlusal filling, I don't want to bring this patient back for an occlusal filling. Nobody has time for that. Or if a patient came in with a broken cusp, I don't want to send a patient out with, a broken tooth or try to figure out how to temporize it. I'm going to try to treat it right now if I can help. So I will use Yapi to let my front office know that we have a patient in a chair. She will print the payment plan and financial arrangement, and will come to the operatory with an iPad and present it to the patient chair side. That way, the patient doesn't have to go out to the front where there is a signature pad of some sort, or she doesn't have to run around the office with paper and then scan it later. It's done so quickly, and I can get started with the treatment as soon as the room is set up. So that's one of and of course, the different kinds of office policies and financial consents. We have that available as well.
Excellent. So I know you have more than just forms and information that goes seamlessly in the chart, and that's amazing because it goes right in that patient's chart. It's there forever. That part's in and itself is amazing, and that is why I signed up for your product. And then I realized there was other layers of depth that you offer. So. Other than the true paperless system, what other systems do you have along with the Yapi?
Well, thank you for bringing that up. So other is we have the practice dashboard. And practice dashboard is really something that we intended as a way for everyone in the practice to be on the same page about what's happening in the office. It's kind of like the Jumbotron. It's once patients are checked in, they show up in Yapi, and so the back office knows that the patient is here. They know whether the patient is filling out paperwork or, ready to be seated. Also, if a patient doesn't come to a scheduled appointment, there's a message that's going out saying the patient is not here, letting the assistant or hygienist know that, the patient is not coming. So. And that's done automatically. Yapi is just constantly syncing with the schedule, checking the schedule. So if we didn't check in the patient, then everyone in the office knows that the patient is not here. And this is really, in every single office that I've been to, you always have what I call the hovering hygienist. It's the hygienist going up to the front asking, is my patient ready to be seated? Is my patient ready to be seated? So Yapi eliminates that. But as soon as the patient is ready, the assistant is alerted. And of course, we can communicate from one room to another. When the hygienist is ready for a check, she can set up the alert and the dentist can see it on their Apple Watch, or they can see it on an iPad or the monitor. It has audible alerts. It has custom colors that are coming, the same colors that we have in the practice management software. So it really allows for the whole practice to be on the same page. And even with the paper, I keep going to the paperwork because, one thing that I'm very proud of is we were the first company. We're not the only option for the forms on an iPad now, but we were the first company to put the forms on an iPad. We were the first company to use Apple Watch for communication. Back then, we actually started with a Pebble Watch, which is no longer available. We're now experimenting with Alexa. That's what our company is all about. We try to incorporate new technology to make things easy as soon as it's possible. So anyway, going back to the communication aspect, one of the things in the past that we did with the paperwork before Yapi is, patients would fill out the paperwork and then they scan it into the document center in Dentrix. But the problem is that once it's scanned, I'm in the back. And as a dentist, I don't know whether something was completed or signed. So someone now from the front needs to tell me in the back to open the document center to review the medical history. And again, that's just wasted communication. And so and it's very easy to miss. So with Yapi, what's going to happen is on a dashboard, there'll be a little file folder that shows, okay, we have some new updated paperwork that you need to check, and you just hover over it or click it and you can review the information. And a lot of the important actionable alerts are showing up in Yapi automatically. For example, if it's a patient's birthday, you'll see a little birthday cake on a patient's avatar. If a patient has a balance, you see a little balance sign. That's so useful because a lot of times in the front office, because of all this interruptitis, we forget things. If you go up to your scheduling coordinator and you ask, do you always collect balance, outstanding balance when the patient is here? And they'll say, of course we do, because that's what they should be doing. But sometimes they forget. And because it's busy, because they get interrupted. And, it's virtually impossible for every single human being to have like a virtual checklist in their head. But what Yapi is doing is it's automatically looking for actionable information in the chart, such as balance and scheduled appointments, birthday, and it notifies the front office via visual alert. It reminds them to take care of those little things. In fact, we also have something called the huddle report, which is very useful if you have a huddle in your office. You can use this as a tool to have a smooth huddle. Or if you're not having a huddle, a lot of offices don't have huddles, this huddle report collects all of the information about the patient from different parts of the software onto one report. And you can use this huddle to just say, okay, show me all of the patients who are coming in tomorrow and they have a balance. And in seconds, you have a complete list. In fact, you can add notes. Sometimes, you need to look in the ledger to kind of figure out where's the balance coming from. And, I know all these things because I used to work at the front office. So many times a patient comes and you notice there's a balance and you say, there's a $20 balance on your account. And the patient always says the same thing. There is? Where's it coming from? I shouldn't have a balance. I paid everything. So we want to have the answer at our fingertips. And what we do in my practice is we review the huddle report for patients who are coming in with balances, and we make notes. Where's the balance coming from? And that note pops up on a screen when the patient comes in. So even if, in my practice, I have 7 people working at the front, but it doesn't matter who made the note. The person that's helping the patient will see the note instantly. And if the balance is paid, the little icon is going to go away. So that's a very useful part of the system. That originally the dashboard was designed for intra-office communication, but it also communicates non-verbally. And, think about it. In a dental practice, when do we have time to have meetings? When do we have time to have everyone in the same room collaborating? I'm comparing a dental practice to my software company, and software company is such a collaborative environment. We're always talking to one another. We're always helping. Everyone is in the loop. In a dental office, the hygienist is with the patient. The assistant is going between the rooms, the sterilization, setting things up, assisting the doctor. The doctor is in the mouth or, on Facebook. And the front is helping the patients. On the phone, patients checking in, checking out. We don't have time to communicate. So the better we organize the information in the same place for everyone to see, the better we can function with less. And that was another goal with creating the dashboard.
If there's just one point that people need to be checking, that increases the chance that they're going to see it. If they have to check this and check that and check another thing, that becomes, not very useful. So if there's one go-to place that they can see, the relevant information for the schedule and patients, then it's more likely to be a useful tool.
Absolutely. And we have practices that where they couldn't practice without it. So I always take it as a great compliment because, you have something in your head and you think it's going to be useful, and then you create it, and then you get this feedback that people feel like they can't live without it anymore. So that's been really rewarding. And of course, we have the patient engagement part to our software. We offer appointment reminders by text and email, recall reminders to patients to schedule appointments, surveys, email blasts. And I think a couple of things that are unique to Yapi with appointment, because everyone is doing appointment reminders. I think if my grandmother were alive, she'd probably have her own appointment reminder company. And there's so many choices. And I think what really makes Yapi unique, not only is the system highly customizable, you can have multiple languages. You can have any kind of templates that you want. But there's two things that I find very useful. One, the two-way messaging is between the patient and the front office computer or any designated computer. So again, it's not some kind of a portal that needs to be logged in. It's not some systems have like an email that's sent with confirmations later. This one is real time on the computer, right in front of the front office. So nothing gets missed, and it's a real it's a very effective way to communicate with a lot of patients because many of them don't have time to pick up the phone. And a lot of times when they call us, I mean, the statistics are actually quite horrible. 30% of all phone calls are being missed on average. And these could be new patients. These could be, existing patients who either want to schedule an appointment or want to cancel potentially last minute. So we need to be able to answer the phone. And a lot of times the reason why we don't is because we're understaffed. A lot of front office, a lot of dental offices are understaffed at the front. They don't realize it because things are just not getting done. So it's not really visible, but that's the case. If you ask most practice management consultants, they'll tell you that that's the case. And so the calls are being missed. She might be on the other line. She might be presenting a treatment plan. And with the texting, when we get our patients to start texting with us, we can handle those things, even if we're on call with an insurance company. Or even if we're maybe helping another patient, we can reply discreetly. And the other thing that I really like about our texting is that we have something called a nanosite, which is really a link that gets sent in a text. And when the patients click on that link, it's like a small website for the practice with all the information about the practice, the phone number, the contact information. You can have some marketing materials. For example, if you're doing implants, You can, have a little blurb about, benefits of dental implants, or maybe Invisalign, or, any kind of service that you want to promote. You can have a link to refer a friend. So there are a lot of different options in that nano site, and the patient has it on their phone now. So again, what we're trying to do is we're trying to pull a lot of different things into, start working together. For example, when a patient texts to schedule an appointment, and we can text them back with an appointment, and then they'll get a reminder going back to them with a link to new patient forms. And so that was the goal behind Yapi, to take multiple pieces of the puzzle and really tie them in together, so that the front office or even the clinical staff does not have to think a lot of about a lot of different steps.
Yeah, you're really making it easy for patients to fill out their information. You're making it easy for that information to get to the office, to get into the system, and you're using tools that are up to date. You're using instant text, instant email, automated notifications. So it's using tools that people are already using. It's using current technology that's available, and streamlining processes, and taking the challenges out of what can be the most challenging part of dentistry is the communication part, which is a major weakness in a lot of offices.
That's very true. And of course, I already mentioned that a lot of the time things are just not getting done because everyone is so busy. And one of those examples is we never get to work on the recall list. And if you ask, well, you have all these patients that haven't been scheduled, even though there may be some sort of automated system sending out messages or even postcards, but some patients just still don't schedule. And when you ask the front office, well, why don't you work on the recall list? They'll tell you one of the two things. They'll either tell you, I don't have time, or they'll tell you, well, it's not working. I did call a few people and they didn't want to schedule. And so they kind of give up on it. And part of it, of course, is training. They have to have, it's not, essentially calling patients who are past due is like cold sales, right? No one likes to do it. And especially if they bungle a few calls, then they kind of, they just don't want to put themselves into that position. So you got to train people how to talk, how to get patients back on the schedule, how to answer their objections. Sandy Purdue has a great training course on that, but I'm sure there are other, very good programs. But the other part of it is that we just, we have this list with like 300, 400, maybe 1,000 names on it. And whom are you going to call? How do you know which patient to call? And one of the things we do with Yapi is we have this recall manager that pulls up all of the patients that don't have appointments and are due or past due. And we're able to filter that by messages sent recently. So you could say, I want to see only the patients that received the text message within the last 2 to 7 days and still didn't schedule. So now you have this short list, maybe 10, 15 patients, and you can have someone responsible for just contacting these patients today. And you can make notes there, and once they're scheduled, they'll go off the list. But by being able to really break up this task into small, concise work of patients who recently received the message and still didn't schedule is very helpful. And here's another thing. They just got a text message, maybe email, and they didn't respond. There's two possibilities. One possibility is here. One is that they planned on calling you, but they just, what happens. You get a message while driving and you think, okay, I'm going to get to the office and I'm going to call them, or maybe I'll text them back. And then we forget, right? And then we remember when we're in the shower. So we think, okay, I'm going to take a shower, then I'll call. And you never do. And so when we call these patients, a lot of them go, oh my gosh, I'm so glad you called. I was just thinking about calling you, because our text message is the idea into their head to call. And now we're reaching out and they're really happy to hear from us. But the other reason is they got a text, they got an email, they didn't call to schedule. And, there must be an objection of some sort that needs to be dealt with. And if we don't reach those patients, there'll be new patients in someone else's practice pretty soon. We don't know what happened. Maybe they got a treatment plan from you that they felt was aggressive and they kind of lost trust last time they were there. Maybe the cleaning was a little rough. Maybe they just lost insurance and they don't realize that we offer an in-house plan. Or maybe, those patients that, doc, ever since you touched this tooth, now it hurts. It's never hurt before, and they really just need an adjustment, but they don't realize it and they're kind of upset, so they're not coming back. If we don't reach them, if we don't deal with those objections, we're going to lose those patients. And this is where Yapi really helps identify who are the patients that we need to contact.
Yeah, no, that contactability nowadays is huge because people's attention span is so short. You need to be able to reach them multiple different ways and maybe multiple times. And so having the ability to continue to track people down electronically is a huge deal. Now, other than the patient engagement, which is great, the emails, the news blast, the recall, the texting, and all of that, you've also continued to expand your platform. You have a review option now. Is that right? So before I was paying for two different services. I wanted yours, and then I wanted the reviews, and now you guys have that, and it's up and running smoothly, and you have the ability to help collect social reviews. So come talk about that.
Well, here's the thing with reviews, and I think a lot of doctors now understand the value of reviews, and I think others are still a little shy, and they almost don't want any reviews. They think if they set up a Google profile, that's how they're going to get that reviews. But the truth is, most reviews are overwhelmingly positive, and those reviews are hugely influential. A lot of times, there's been a statistic that somebody did a research, and I can't remember the name of the company that did the research, but they showed that 78% of patients say that they believe reviews as much as a personal recommendation. Word of mouth used to be, when you ask your neighbors or your coworkers where you go, and we still have that. In my practice, we get about roughly 100 patients a month, and I don't do any marketing. Half of those patients are coming from personal referrals, but the other half, and some of them are coming from the sign, and at least 25% of the patients, and I don't, these are obviously very rough numbers, but at least 25% of the patients are coming from reviews. They'll say that they found us on Google or Yelp or even Facebook, and the reason is because we have a lot of great reviews, and even patients who find out about us from other sources. Maybe they saw our ads, maybe they saw the billboard, or maybe a friend told them about us. They'll still check Google and Yelp and read those reviews. And sometimes, it doesn't mean that you have to have all 5-star reviews. An occasional negative review makes it look a little more authentic, but it takes 15 reviews, 5-star reviews, to offset one negative one. And you don't get negative reviews by being a bad dentist. It's going to happen to someone sooner or later. A patient will post a terrible review over a $22 payment or something, and you can tell sometimes that the review is not reasonable. Actually, most of the time you can tell when it's not reasonable, but it'll happen sooner or later. So working on gathering as many 5-star reviews as possible is important. It's important because when they look at our listing, all those stars are showing up, and it's really like when you Google a dentist, and in a 3-pack, you're going to have 3 different dentists, one with a bunch of 5-star reviews and the other one with no reviews at all. Who do you think they're going to call? And so getting those reviews is very important. But the problem is that only a small percentage of patients are actually going to write reviews. If someone is a Yelper, they'll Yelp anything, from a dentist to a restaurant to a public bathroom. Everything gets a review. But most people are not Yelpers. Most people will either never write a review, or they will write a review when they're appreciative of what you did for them and they want to give you something back. And so they may not think of writing a review, but if you ask, then they'll definitely do it. So the system will ask for reviews automatically. What's going to happen is a patient will get a text message, and if they say, and they'll ask, did you have a 5-star experience with us? You can customize the question, and if they say yes, then the system will ask them to write a review on one of the sites. You can choose which sites you want to use. Typically, Facebook, Yelp, and Google are the sites that you want your reviews to go on. You can look at health grades. You can do up to 4. And typically, patients will use whatever app that they're normally using. Most will have either Yelp or Google login, and mostly everyone has Facebook. And if they say no, then instead of taking them to a public site, Yapi will ask them for private feedback. And the feedback will go into Yapi on the dashboard, and it will also be privately either texted or emailed to the dentist or the office manager, so it can be dealt with right away. Even though the system will ask automatically, you get much better conversion if you actually do the asking. So when the dentist asks, you get the most reviews. But if the dentist asks, the best place to ask for reviews is at the checkout. And the reason is because it's so natural at that point to ask the question. When the patient is leaving the office and the scheduling coordinator says, "How was everything today?" And they'll say, usually, "Oh, you guys did the best. You're wonderful. Everything was great. Gosh, thank you so much for sharing this. Hey, I want to send you a link to one of the review sites. Do you mind leaving that feedback for anyone who might be looking for a new dentist?" It would really belong to us. It'll only take a few seconds, and I'm going to be looking forward to reading it with my team at the huddle. And usually when you put it this way, usually when you tell them you'll be looking forward to reading the feedback, that's when they're going to leave a review.
Yeah. No, I think like you said, a lot of times if the doctor can ask, that'd be great. If not, the logical conversation could be the checkout, because you might be asking, "How was your visit anyway?" If they say great, say, "Oh, well, good. We've got a new system. We'd love to send you a link and leave us a review. It'd mean a lot to us." It can be an easy kind of no pressure deal, but the texted link takes that first step of action and leads people there, so they don't have to pull out their phone, look you up in the system, do all this and that. It just they have it right at their fingertips, and then it truly just takes a couple seconds to do. So the more barriers you can remove for the patient, the more likely they are to do it for you.
Absolutely. And, a lot of people are not, despite all this technology, a lot of people are not technologically advanced to where they can figure out how to do it. A lot of patients have said, "You know what, I'd love to write you a review, but I can't, what am I doing here?" So by taking them straight to Google and already pre-filling it with 5 stars, I mean, we've eliminated a lot of different barriers there. So it works great, and it works even better if the office asks.
Yeah. Asking is the key.
Yes, I truly believe that. We can automate a lot of things, but we're still a relationship-based business. And actually one of the things with Yapi is that the message itself that we're sending to the patient is customized with a provider's name. It could be even a nickname. So for example, instead of saying, Gina Dorfman DDS, I could say Dr. G or Dr. Gina or Dr. D, whatever I want to nickname myself. So the message says, "Hey, Philip, this is Dr. G. Was great to see you today. How was your experience?" And if they say great, then, that's when we take them to a review site. So again, I've had patients who assumed that it was either me or the hygienist actually sending the message because it's made to look personalized and not like a lot of systems use a very, it's like a huge link that looks a little spammy, and they send multiple messages to different sites. And Yapi really creates a better experience for the patient when it comes to asking for reviews. Again, we're not the only ones who are doing this, but the price is a no-brainer. If you're already using Yapi, it's not available as a standalone, but if you already using Yapi, it's a great, very cost-effective addition.
Yeah, you just got to kind of think of that as your marketing budget, and you can also think of that as your damage control, because if patients aren't happy, better sooner, better to know that sooner than later, right? And cutting off that ahead of time and having your team retry it out and say, we noticed today was kind of tough for you. What, let's have you talk about that. Let's talk about this and figure out a way to make it right. Sometimes that's the biggest thing, with negative reviews is cutting those off early. So, like you said, just comes down to communication, and the better tools and the better communication you have, the better off you're going to be.
Absolutely. There was, I'm sure you've heard of that survey, that 67% of patients will leave, or customers will leave a business or practice because of perceived indifference from an employee. Not the product, not the service per se, but just they don't care. I mean, who wants to go anywhere and feel like they don't care about me? We understand that mistakes happen. There are a few unreasonable, crazy people out there. Well, maybe more than few, but majority of us, we understand things happen. Sometimes the steak gets burned. Sometimes, you have to wait a little longer to be seated for your appointment. Sometimes we can make a mistake with insurance, but if we reach out quickly enough before they actually go online and rant on Yelp, if we can catch them, and let them know. I love what you said just now. Hey, today was tough for you. I mean, great verbal skill. Let's talk about this. I want to know. And the team needs to be trained in having those conversations. It's not a pleasant conversation to have, but it's essential for patient retention, for reputation management. And, Yapi can also send out surveys. That's part of the patient relationship management product. So they can get email surveys, and even they can actually be asked to post reviews straight from the survey. Once they give us feedback, they can also post a review online from there. But the reason why we developed that tool primarily is to understand who is leaving happy and who is unhappy, and what can we do to improve it. And we want to get that feedback as soon as possible.
Yeah, anything we can get real time, the better off we are. So what is the last, the model we have? We have, you have a phone assistant. Tell me about the last segment of your process here.
Well, again, the process is the same. What our goal is to get to the information quickly. And typically in a dental practice, when the phone rings, we pick up the phone and then we are like, what is your name? Can you spell your name again? Have you been here before? And this is just it's not a great way to welcome a patient, especially if this patient has been with the practice for quite a while. So what Yapi does is, once the phone rings, there's a pop-up on the screen that tells us who the patient is and what we need to do for them. If there's a balance, again, if it's their birthday, if they need to schedule a cleaning appointment, if we're missing maybe an email on file, all of that information is on that pop-up. And, we can create a completely different experience for the patient, and we can make sure that we get all those things done. I mean, it's so, common for a phone to ring, receptionist picks up, or scheduling coordinator, and, maybe the patient is canceling appointments or maybe making an appointment, and there's a balance on file, but she doesn't notice it because who can possibly remember to do every single little thing that needs to be checked, right? Especially if, in my practice, we collect up front. So a balance is not something that's typical for us. But it can happen, maybe insurance denied payment, maybe check bounce, and it happens. And so catching it and handling it while the patient is on the phone is such a time saver. And it's also great for patient management because, that's going to be a patient that's coming in later saying, why do I have a balance? No one told me. I was just on the phone with you a couple of days ago and you never mentioned it. So, or maybe it's the husband coming in. The wife is the one who makes appointments and pays the bills. Now the husband comes in and he's like, well, I don't know anything about it. I got to talk to my wife. So, that's another part of the system that helps us prevent lost opportunities. Now, one thing I should say with a phone assistant, it's only available with certain phone systems. We integrate with some voice over IP phones, and we also work with landlines. So before signing, if anyone is interested in that, before you sign up, give us a call to make sure that the system is compatible.
Yeah, that's great. It's just another tool to know speed and efficiency and quality control. And I think the more you can embrace technology on that front, the better off you're going to be. So tell me about the different options you have. Obviously, you have all these different series of availability. What does that mean with pricing? Some of it's bundled together, some of it's add-ons. You have to get one thing, or you have some different startup packages for new offices. Kind of walk me through. Okay, if I want to get going with this, you at least have to have this, and then what other options are there?
Absolutely. So we have something called the Works. The Works includes patient engagement through paperless dashboard. So a lot of the basic features that we've talked about earlier, and all of that is $299 a month, which is a great value, because when you start thinking about stitching different systems together and paying appointment reminders separately, and then some of the other features that we didn't discuss, like some KPIs that can be looked up in a glance quickly, and a lot of different little sub features that we didn't discuss. All of that is included, and on top of it, you can have Insta Review, and on top of it, you can also have the phone assistant. Each one of those is $49 a month extra, and the reason why they're not built in the basic package is because not everyone is going to be using those systems. For example, with the phone assistant, I think it's incredibly valuable. I love using it in my practice. My team loves it. But, if you don't have the system that's compatible, or, you don't see the value, this is where you can go with just the Works and have a lot of great features for a very good price. Now, if you only want to go paperless, or if you just want the patient engagement, you can get those obviously separately and for only $199 a month. And with Yapi, there's never a contract. We want to work on earning your business. If you're not happy, we want you to be happy. We'll find you another company to work with.
Yeah, I think that's great. I used to use one of the old original companies for years and years, and they always had a 1-year, loophole. You got to give them advance notice about quitting, and they get you on a year-long contract. And I'm always a believer of, if you're doing things right, and I'm creating value, and you're happy with the product, I'm gonna keep giving you my money. So I think the monthly is the way to go. There's a little setup fee, and then for $99, $199, or $299, you can basically find out what does that office need, and then the Insta Review for $49 extra. I was paying a different service, over $100 just for a review process anyway. So I think it's great that you're adding bonuses on there and allowing people to kind of customize what works for their practice, and they can integrate whatever works for them.
That was always our intention, and we do. One of the reasons why we actually offer paperless separately is because we've had practices that wanted to go with paperless, but they were still locked into their contract, and there's always like this magic date by which you have to cancel, and they miss it, and then they're locked for another couple of years, which is I don't see a point. We've had customers using Yapi for 5-6 years, and if they ever decide that it's not right for them, I'll be disappointed to see them go. But ultimately, it's all about, it's a small industry, and ultimately someone has to benefit, or I'm not providing value, and that wouldn't be acceptable to me.
Yeah, no, I think that's where we're at now. We expect a lot out of the people that we do business with, but we want a good relationship. You want to get value for your services. In your company, you put a lot of time and effort into this, and it's something near and dear to you, but you want your customers to be happy and maximize their benefit there. So, you want to find people that it's a win-win relationship for. And that's why I really like your company. There's other companies that really don't care if you're using their product or if you're enjoying it. As long as your check clears every month, they're happy. And, I can say from personal experience, my staff and I have called your company numerous times, and every time we talk to somebody there, they are very helpful. They're very pleasant. They're just you've got an amazing staff. I'm not sure who it is that's doing all that for you, but you've got a great team, and that's a huge piece because you just don't sell somebody something and drop them on the curb. Your team really makes sure that where you get the webinars to bring people up to speed. They're always available for questions and help, and I think that's a big deal.
Thank you. We definitely that's always been my goal, is to to create, just like with my practice, create a place where people like to work, at where I like to be, something that I want to I can be proud of. It's my baby. It's, for me, that's always been the motivation. And, even with coming up with the software, it was part of that same, desire to create a better workplace for my employees, for me at the dental office. And essentially, I hire people, I hire people that I like, and I think it shows. I don't necessarily look for a lot of experience, but I look for a lot of enthusiasm and, a good, the same type of personality that I have, wanting to create something that's a little bigger and than themselves. So thank you for saying all those wonderful things. It makes me feel really good right now.
Yeah. You've got to surround yourself with great people, and you've got to have good products and good partners. I always tell people it's about the partnerships and the people you hang out with. If you have a good team, and I don't just mean your employees, you have to embrace technology. So you might as well embrace someone who's on your side. You have to embrace certain things in labs and various people and operational systems. So pick ones that are going to do you well. And be there for you and work with you and work for you. And I think, you've definitely done that for people, given them a good solution. And we really love it. Now I know we've worked with you we're getting ready to launch our partner program, and you are generous enough to work with us on our partnership with that for the GPO partner program. Tell me a little bit about the offering that we're going to have for the people that join our platform. I think, you guys have some startup fees that you're going to help waive some of that and also give them some months for Insta review. So kind of tell me what people can expect if they join the Dental Implant Practices Platform Partner Program.
Great question. So as we discussed, I wanted to make it easy for someone to get started with Yapi. And so what we're doing is we are offering a $200 credit towards whatever subscription they choose. And we also want them to try Insta Review. So we're going to give 6 months of Insta Review for free. After that, it will be $49 a month with, again, whichever plan you sign up with. But I think even in that 6 months, it's going to be a great value because you're going to be able to get quite a few reviews.
So you're going to make it easy for people to get in with your system. So reduce a little bit of the cost that it takes to get into it, and then give them basically a half a year trial on the Insta Review, and almost guaranteeing they're going to get more reviews. So that's going to help push more business to them and help keep the reputation up. And then after that, just continuing to provide them great resources moving forward. And so I think, that's an amazing way to do it. It helps break down the barriers of, should I give this company a try? Okay, well, let's reduce the upfront cost and let's give them something tangible to try out. And I think that's a great way to do it for people. And then once I know that they use your product, they're going to love it and stick with you.
Well, thank you.
So your company's website is Yapi, YAPIAPP.co. Is that correct? Is that the company website?
Yes, yapiapp.co.
Okay, so yapiapp.co. So I want to make sure that we'll put the links to that in the notes, but it's YAPIAPP.co. So yapiapp.co. Is that the best way for people to get a hold of you? I know you've got breakdowns of all the products. You maybe have a video they can watch. They can look at the pricing. They can schedule a conference call to work through someone. Is that really the best way for people to go through?
Yapi is very visual. I said a lot of things, but you can't really appreciate it until you see it. So I think the best way is to register for either a demo, which, there's a complimentary demo available on our website. It's a live demo, so we customize it to each practice to show them what they want to see and how we can help them. Also, you can register for a webinar. We try to do at least a couple of webinars where I'm personally showing how to use Yapi, and I talk about how I use it in my office. So I find it that for a lot of people, it's very helpful to kind of not only see the product, but also understand the little stories and, behind the features and how I use them personally, how I find them useful. And of course, I'm always on Facebook. I'm on Dental Town. I mean, you could always PM me or send me a message. I try to reply as quickly as I can. I love talking to people. I think this was probably the most rewarding part, is to be able to interact with our customers and anytime I can help someone that's huge. So anyone who wants to talk to me personally can always reach out.
Yeah, I know you're very available to people and you're very open and honest, and I appreciate that. I think people love the transparency that you have. It's great to deal with somebody who puts out a good product and stands behind it and doesn't have anything to hide behind it. I think it's refreshing to deal with people like that, and I know that you've done a great job at building this great company and this great product, and you're continuing to see it forward. So really looking forward to the partnership that we've got with you. Like I said, I love your product. I love what you're doing, and just want to help you continue to spread the message and help people with their dental practice. It's like I said, it's been really great talking with you, and I think your practice management resource tool that you've got here is amazing. So we're loving that we're getting to partner with you moving forward, and really looking forward to getting into this relationship with you and working things forward from here.
Thank you so much for having me. It was such fun. Thank you.